Mark, an international business entrepreneur from Arizona, has arrived at Modena Hair Transplant Center in Las Vegas for his first hair transplant surgery. Mark has chosen Modena, and after brief negotiations during the holidays, he finds himself in Las Vegas.
Hi, my name is Mark and I'm here in beautiful Las Vegas at the Modena Hair Transplant Center. I just came out today from Scottsdale, Arizona to meet with Dr. Yazdan. Over a year ago, he did my brother's FUE hair transplant surgery, and I wanted to find out from Dr. Yazdan what he could do with my receding hairline. It's been getting worse over the last 5 to 10 years, and this new exciting method, looking forward to learning more about it and finding out what they can do to help my hairline.
Mark is in the office of Dr. Yazdan, who carefully studies the condition of his follicles, the density of his hair, and the viability. It is necessary to plan the transplant in detail to ensure the best possible results. The patient can see all his information on the computer's monitor.
In aging patients with typical male pattern baldness and a receding hairline, it is necessary to restore the hairline and the angles. I think it will be sufficient to fill the temporal area and to lower the hairline. Your hair looks healthy and your donor zone is perfect. It will take approximately 1,500 grafts to fill this area and to lower your hairline and fill the sides and temporal area. We will use the FUE method. We will begin at 8 a.m. and by 5 o'clock we will finish.
The surgeon carefully measures and reconstructs the patient's hairline. It is of the utmost importance to create a natural and optimally dense hairline. It is not necessary to cut the hairs before hair transplant surgery using the strip method, but with Mark it was decided to perform follicular unit extraction.
We shave off a small area of your hairs because we are doing follicular unit extraction procedure. For this, it is necessary to shave a small amount of the donor area.
After the patient has undergone anesthesia, the doctor extracts the grafts from the patient's existing material. At Modena, under the direction of MD Yazdan, they have developed a unique process for anesthesia. The patient feels no pain during the course of the surgery or after it. The area is also not subject to swelling, as is typical with hair transplant procedures. On the day after the surgery, when we see our patient for follow-up, it is impossible to tell the day before he had undergone hair transplant surgery. Modena's techniques also virtually eliminate the risk of an allergic reaction. As this is Mark's first session, an FUE extraction technique is applied to ensure a necessary quantity of grafts. Now we see how the extraction of hair takes place. Separate grafts are extracted from the donor zone in this manner. Accuracy is essential to procedure, as is the experience of the surgeon and the tools available. It is crucial to ensure that the grafts are not damaged in the process of extraction. The surgeon's technique and use of a tiny 0.8 mm punch ensure virtually no scarring. There are no stitches, and the wound heals within 3 to 4 days after the procedure. It's not only the quality of the graft extraction that is essential for a successful hair transplant, but also the quality of their processing. The longer a hair remains out of a human body, the greater the stress it experiences and the greater the probability that a graft will not settle. At Modena, to ensure the grafts are processed quickly and professionally, between 3 to 5 assistants work on graft processing for each surgery. This is a substantially large number of support staff compared to the majority of other clinics. This enables large procedures to be carried out in a very short period of time, guaranteeing an almost 100% graft survival rate. grafts are processed by highly skilled personnel with the use of state-of-the-art microscopes. While the surgeon extracts the follicles, the rest of the team works to process the grafts. It is an extremely laborious task requiring attention to detail and modern magnifying equipment. Mark takes a break and prepares for the next stage, implantation of the hair. Pay attention, once the extraction process is completed, the area already looks presentable. The donor zone shows little sign of bleeding and is covered by the surrounding hair.
Hi, this is Mark again from Scottsdale over here in Las Vegas at the Modena Hair Transplant Center. We're halfway through my procedure. There's been literally no pain at all, and looking forward to moving the hairs to the front and finishing up the FUE procedure.
In the meantime, the surgeon starts to prepare apertures for the grafts in the recipient zone. At this stage, it is also very important for the surgeon to take into account the direction of hair growth. In Modena, we use the latest precision tools which enable the transplant of grafts in the minimum possible time and the preservation of the direction of hair growth set by the surgeon during the creation of apertures. Furthermore, the small diameter of the apertures ensure the natural density of hair in the transplant zone. The hairline, the direction of hair growth, and the hair density are all carefully calibrated to ensure an authentic natural look. Each aperture is counted by a special device. It displays the figures on the monitor, enabling the surgeon to check on the accuracy of the apertures in real time.
Hi, it's Mark again, and I'm here with Dr. Yazdan and his team, and we're finishing up the final stage of the FUE hair transplantation. As you can see, they're putting the hairs and locating them in the receding hairline areas on my forehead, and this will be the last step, and it's very, very painless, and they're doing a great job. Thank you.
It is well worth noting that in the course of the procedure lasting many hours, there is virtually no blood. 4 to 5 persons work to transplant grafts, as it is of the utmost importance to keep the operating time to a minimum. On the second day, Mark comes to the clinic again. Our personnel wash his head, the doctor gives some final recommendations, and he says goodbye to the team.
Hi, I just finished my FUE procedure, and I'm very excited to see the results. The procedure itself was literally pain-free. I highly recommend Dr. Yazdan and his hair transplant team.